Good morning. It's April 7th. So I want to talk to you about the antibody test that we now have available in the office. So I've gotten calls already. We just sent in information to our practice late yesterday about how I got the test and where the test came from. So one of the advantages of having a small independent practice is we can be much more nimble and navigate the situation much more quickly than big health systems. And so what that's allowed me to do, frankly, is really be in the mix, quickly watching what's happening in the space in terms of testing. So as you may know, in the middle of March, the FDA really loosened restrictions on kind of testing. It was very clear at that point by the middle of March that we didn't have adequate testing, and we were looking to the private sector to try to figure out how to scale testing, both the RNA testing and the antibody testing. What that March 16th FDA guidance did is put in place something called the EUA, the Emergency Use Authorization Act. And what this has allowed companies to do is to commercialize testing with much less restriction, not zero restriction, but they don't have to go completely through the FDA approval process. And so now there are tests, and you may have heard last week that there were some antibody tests that were approved by the FDA, but now there's the ability for companies to commercialize tests that aren't yet approved by the FDA, as long as they meet certain criteria and they have notified the FDA through their complicated process. So antibody testing has been done in China for some time and in Europe. And this particular company that I acquired my antibody testing from, called Premier Biotech, has brought the testing in from China. These are antibody testing kits that I purchased to be able to do antibody testing in my office. Again, there's a separate video to explain that antibody testing is not the same as the RNA testing available. This is antibody testing, not active virus, but whether or not you've been exposed and have mounted an antibody response. And this is a test brought in from China by Premier Biotech, and there's other companies commercializing this as well, that is not yet FDA approved, but they have submitted information to the FDA with data about sensitivity and specificity and the accuracy of the testing, and the FDA is okay with them commercializing it. So, as you know, I really practice evidence-based medicine. This is a test that is not FDA approved, but in the interest of trying to help my patients have more accurate information and get this into the community, I'm now doing testing for both patients in my practice as well as community members in my office, and I actually have submitted an IRB to actually do this as part of a research study as well, so that we can actually get some data from this testing and look at the prevalence of antibody positivity, right? You've heard all of this about how many people have had asymptomatic infections and we just don't really know. So trying to do this testing correctly, and for patients who want to be tested, and again, no one has to be tested, but if you want this information, we're doing the testing. Now, in the future, in the not too distant future, I believe that there will be multiple rapid FDA approved testing once the FDA gets through the process and is able to approve other companies and commercialization and production in the United States of these test kits. But that's a little bit of a ways off. And so in the future, there might be another test that we will do for patients that will be FDA approved. But again, because I'm trying to work hard to get information and appropriate testing to patients, I made the decision to purchase these test kits from Premier Biotech and to roll it out to my patients and patients in the community. So if you have any questions, please go to my website. There's lots of information there. If you're interested in testing, please call the office to schedule. We are not having patients come into the office to protect everybody. We're actually doing the finger stick. My staff will come out to your car in our back parking lot. So again, please call the office before you come. Find information on my website. And I will be doing 2 Facebook Lives tomorrow, one at 3 p.m. and one at 7 p.m. That's Wednesday, April 8th, to take your questions. Thanks. Have a great day.